Hey guys, I'm Alicia, your registered dietitian,
And I'm Andrea, your medical doctor.
and this is
The Peared podcast. So, Alicia, how's your week?
My week was good. It was so busy, but it was good. Yeah.
Tell me more about it.
What did I do this week? Oh, I was just learning and learning and learning. The amount of reading I did this week was crazy. My brain is like fried. But how was your week?
It was good as well. Also quite busy. I think saw the record amount of patients this week. And
Really?
yeah, I had quite an interesting encounter with a patient.
Ooh, tell us more.
So I was seeing him for something unrelated, but he so happened to also have diabetes.
Okay.
And a thing that a lot of people don't know is that diabetes can affect your entire body.
Yeah.
And his main concern was, struggling to perform and,
Perform where?
in
In the bedroom.
yeah, in the bedroom. So,
Wait, diabetes can affect that?
yeah, so
Oh,
it can
wow.
because it affects your nerves in your body if
True.
it's poorly
Oh, okay,
controlled,
yes.
as well as blood supply to the different parts of your body.
That's true, yes. Oh
Yes.
my word.
So he was quite distressed about
I
it
couldn't imagine.
and couldn't relate to where the scores could be.
Yeah.
And then when I evaluated, oh, okay, so I'm seeing you for this other problem, but you're also diabetic.
Yeah.
And then seeing that his HbA1c was 10.5.
Crazy. That's high. Guys, it's supposed to be below 7.
Yeah,
Right?
so WHO says less than
Yeah.
7, but South African guidelines use less than 8
Yeah.
for your HbA1c. So HbA1c is a measure of your chronic control of glucose.
Yeah.
I won't get into the science of it, but it's not a point of care,
Yeah. It's like
finger
your-
prick.
your
glucose,
long-term,
your
how you've-
long-term,
yeah.
3 months. It shows you an average of your 3 months
Yes.
of your blood sugar control because of the red blood cell, the life cycle. And
Yes.
yeah, so I won't go into too much science, but that was
Yeah.
quite interesting.
That
this
is
week.
interesting. That was interesting for me as well.
Yeah, so I think if more people know that it can affect that part of your life,
then people will take it a bit more
seriously.
Yeah. So
Yeah.
what is diabetes?
so diabetes is a chronic metabolic disorder.
Yep.
And it's an issue with how your body processes sugar, and it could be caused. So diabetes is a broad definition, and there's
Yeah.
many different types of diabetes.
Yeah.
You get diabetes type 1 and diabetes type 2. You also get gestational diabetes, diabetes can't say that word.
In?
We won't go there. But for the purpose of this
Yeah.
podcast, we're going to just talk about diabetes type 2.
Okay,
Because
yeah.
that's the most common.
Yes.
So
yes.
more than 90% of diabetes is diabetes type 2.
Yeah.
Yeah. And you obviously work a lot with diabetic patients.
Definitely a lot. Yes.
Yeah, and
I've
what-
seen my fair share of diabetes.
Exactly. It's, our bread and butter today. There's so
Yeah.
many people.
Unfortunately, hey, in South Africa, what are the stats of diabetes in South Africa now? I know it's quite high.
Yeah.
Throughout the years, diabetes has grown, and
Yeah.
it's so sad.
It is sad. So in 2021, 1 in 9 people were diagnosed with diabetes. And let's just see here, it equates to about 11.3% of people in South Africa, which is about 4.2 million cases
That
reported.
is crazy.
Yeah.
That is so
It's
crazy.
a lot. And the burden of disease is just increasing.
Yeah.
So in 2040, they're predicting it to be about 10.4% of South Africans, which will be about
That's a lot.
822 million people. Yeah. I spent some time in the diabetic clinic
Yeah.
this week, and it was incredibly full. So the system is struggling.
yeah.
I don't think we have enough resources.
yeah.
I don't think we have enough time to spend with diabetics
Yeah,
and
that's true.
counsel them and support them, and also to prevent some of these issues from even beginning. Like the prevalence of it shouldn't be this way.
Yeah.
We are.
But I think it's like this because people don't know, right?
Yeah. So people don't know their risk.
Hopefully this can help people
Of course.
Understand. So, Andy, tell me, what are the symptoms? Like, what do we look for? How would you know someone has diabetes? How would I know that
So it's a variety of symptoms, and some people walk around for years without knowing that they are pre-diabetic. And sometimes it's just, increased thirst, increased urination. Some people have weight loss. So it also depends on the type of diabetes that you're
Yes,
presenting with. But specifically for type 2, we can see some of the symptoms presenting itself. But also the clinician might be flagging a specific patient based on maybe risk factors such as obesity, as
which
well
is
as
a big one.
as well as hypertension. And some of them might not even have symptoms. So, but increased like thirst and increased urination are probably the most commonly seen.
Any physical symptoms that you can?
So if it's a patient that's maybe undiagnosed and they present in an emergency situation, we call that diabetic ketoacidosis. And they could have symptoms of, rapid breathing, as well as could be comatose. So that's like the extremes of it.
Yeah.
So that would be more in an emergency situation. And I've treated my fair share.
Same.
It's, it's become such a common occurrence most of the time.
It's because a lot of people go undiagnosed and then they end up in diabetic ketoacidosis.
Exactly. Or even poorly controlled. So not taking treatment, not necessarily doing the lifestyle modifications that's so necessary.
That is true.
So just seeing that end spectrum. And I mean, diabetic ketoacidosis, DKA, is a life-threatening condition. So it's a state of high glucose in the body, but also your pH, which is your acid. There's a lot of acid, so your pH is very low. And your cells in your body need to live in a certain environment. So it's not conducive to your body and its functioning. So people are very sick. There's many things that can, precipitate that situation, infections, so other causes, but also we see it quite often when people aren't taking their medication or alcohol binges, etc. So it is a life-threatening thing. And those are just one of the complications. Diabetes affects your entire body. So lots of people end up with, diabetic foot or an amputation or blindness.
How does that happen? Because I've worked with a lot of patients who have had amputations, diabetic foot, but I don't think people actually understand how does the diabetic foot happen.
So it all has to do with the damage that the glucose, the sugar does in the blood circulation, in the blood vessels. And it's usually I like to think of it as the smaller vessels in the body that get affected. Not first, but I mean it's usually more vulnerable. So the ends of your feet, your eyes, your heart, it's all supplied by blood, and also your nerves. It can be damaged by that high glucose level. Okay, it's inflammatory. It's irritating those blood vessels, and because of that high sugar level continuous, it decreases the blood supply to that part of the body. And then it's like anything, you need blood, you need oxygen to allow that tissue to survive. So if there's no oxygen or blood supply, that tissue can die. So then that tissue dies, and it creates a perfect environment for bacteria to grow. And then people also don't have sensation because of the nerve damage. So they don't even know sometimes that they have a sore on their foot.
Yeah, that's true.
And then before you know it, the infection has spread, and we can't save the leg. We need to, life before limb, and we need to amputate to control the infection. So it's very sad.
It is sad.
Walking through a surgical ward and seeing patients laying there after an amputation. Sometimes it will be the one foot, then the next time they come, that's next foot, or it's going higher and higher and higher. And when you're seeing a patient in the clinic, it's so difficult to translate that this is what can happen to you. It's not just about your HbA1c.
Yes.
It's trying to prevent these
All
complications.
of these, yeah. What other complications are there? So there was diabetic ketoacidosis, there was amputations, losing your foot, other limbs. What else?
So your eyes can be affected, diabetic retinopathy. And that obviously impacts your quality of life.
Yep.
And your
not seeing is hectic.
Yeah, I mean they have some therapies that are available, but your eyes are so important. So eyes are a big one, and then also increased risk for heart attacks and strokes.
Yeah. Okay.
So it's literally your entire body, and these are the top causes of mortality and morbidity in South Africa.
Yeah.
And most of these things are related to each other. So we find a lot of patients don't only have diabetes, they also have hypertension. And
cardiovascular disease, cholesterol, high cholesterol, all of this.
Yeah.
Yeah, because we know once you have one chronic disease of lifestyle, then you're at risk of all of the others.
And then the risk that follows with that, heart attacks, strokes, all of that. Okay. Yeah. So you are obviously a dietitian. Yes. We know this. What type of dietary advice do you use, and guidelines or anything like that?
So because we're working with sugars, right? Sugar is a big thing. Decreasing the amount of sugary foods that you eat, which is hectic in South Africa, because I feel like we have a large population that eats a lot of sugary foods. Yeah. Sugar, Coca-Cola. I don't want to say Coca-Cola. But Coke. Any carbonated cool drinks.
Carbonated drinks.
Pepsis, all of those things. Any cool drink. And the other thing is fruit juices. People don't realize, because you think, fruit juice comes from a fruit. Yeah. But it's actually a lot of sugar that's in there.
And the fiber's removed.
Exactly. Because it's processed. It needs to... A fruit juice doesn't last for long. Yeah. Fruit juice that you buy from the shop, it needs to last for a period of time. So there's things in there and
things removed. Like if you have a glass of apple juice versus eating an apple, your body responds to that differently. In terms of your sugar spikes. Yeah.
So it's decreasing all of those things to help with sugar. So before I get in, I wanted to say with type 2 diabetes, my tongue, something that we explain to our patients, an easier analogy is like, if you picture all of your muscles in your body is like there's a door to get into that muscle, right? Or in your brain or your organs.
I literally use this explanation all the time.
For your patients.
Yeah.
So you need a key, and that insulin is a key to get in. So and the sugar is like the people trying to get into these doors, right?
Okay, I didn't use that part. That's a nice analogy.
So in order for these people to get in, to start working on your muscle, the key needs to open. But in type 2 diabetes, the key is like it's changed. Yeah. So the door doesn't recognize that key. Okay. So the doors aren't opening anymore. Properly, yeah. And then the people can't get in to work on that muscle. So that muscle can continue working. And then it's just a whole bunch of sugar in your blood.
Yeah.
A whole bunch of people that are not going in. Yeah. And that's basically what diabetes is.
It's like traffic.
Exactly. Basically traffic. Yeah. So
no one likes traffic.
I hate traffic. But anyway, that's another... But we need to reduce that amount of sugar. Yeah. And we need to get that key working again. So the main macronutrient, we've already spoke about now, the sugars that we need to decrease, any sugary foods, the amounts of teaspoons of sugar we put in our tea, our coffee,
It's crazy when you hear people like 5 sugars, please. And I'm just like,
when I make coffee for someone or tea for someone, and I'm like, how many sugars? They're like 3. I'm like, huh? But I need to stop doing that. Everyone has it. But it's so funny. I digress. But it's so funny. Everyone how I make coffee and tea for. When they tell me 3, I'm like, right, how am I going to get you down?
I'm going to give you 2.5.
Okay, so we're going to go for 2.5. Then like next week we'll do 2.
Exactly.
But it works. That's how we decrease our sugar. So decrease it by half. You don't have to go cold turkey immediately.
Yeah.
So just decrease, and by the time you get to 1, oh my word, the difference. You wouldn't be able to add another teaspoon to your coffee or tea. You'll be like, oh my word.
Yeah, I had black coffee with no sugar this morning. And the lady looked at me, she's like, no sugar. I was like, no, thank you.
You're bland.
I was like, but it actually tastes normal to me because that's how I drink my coffee now.
Exactly. I used to drink 2. Now I drink 1. I'm still going to go to 0. Still need to get there.
Sometimes I'll have.
I'll get there soon because I can't deal with 2 sugars.
Yeah, no, it's too sweet now.
Too sweet. So decreasing the amount of sugars we eat. And then the main macronutrient is carbohydrates that affect our sugars. Okay, so carbohydrates are like your rice, your bread, your pastas, all of those things. So you get high GI, so a high glycemic index, and that just basically means that these types of foods, they increase your sugar fast, and a low GI will be a low gradual increase. And that's what you want. You don't want a whole bunch of people at one time, like
peak hour traffic,
load shedding, and there's so many people at one time. And then
you need that energy to get into your cells, but at a constant level.
You want like a slow release. So that's why we recommend a lot of low GI foods to our diabetic patients, and these come from things like whole grain, fruits and vegetables, lots of high fiber foods, and things we can tell. I mean, now there's a lot of labels. The food labels have a lot of, okay, this is a low GI product. Yeah. So that's easy to tell. Bulgur wheat as well. Couscous. Well, whole
legumes.
Legumes. Yes, legumes. Quinoa. So important. Quinoa. Yes. So important. Legumes, high fiber, has your micronutrients in it. So those are carbohydrates. They can slowly increase your sugar for your body's needs. Exactly. And not cause that spike. Exactly. And then also decreasing the amount of carbohydrates you put on the plate. So like I think in our previous episode, I also spoke about how much in hand models, how much you should eat. And I can't remember if I spoke about the plate, but basically a quarter of your plate needs to be the carbohydrates. We can't go more. You can't, if you eat too much, then there's going to be large amount of sugar in your body, and you're already not, the key's not working, so there's no way for that sugar to go. So we have to decrease the amount of sugar so that our body can get used to opening those cells again and letting the sugar in. So decreasing the amount of carbohydrates. And I think in South Africa, because our cultural foods are mostly carbs, and that's also the most affordable foods. So that's
it's difficult to balance it.
Exactly.
So I think also people are a bit confused, like what causes diabetes and how do you manage diabetes? Do you understand? So some people now will think that carbs causes diabetes.
No, it doesn't cause it at all.
So it's more the fact that people are overweight and obese, that their cells aren't able to process sugar the way that it normally does.
Exactly.
And then what causes the sugar to be high would be the
just eating too much of the foods,
processed carbs
and processed
carbs, which will shoot your sugar high, and then long-term control of your sugar will be affected if you're continuously eating the chips and the bread that's white bread, or a lot of rice, or a lot of pizza, or whatever the case might be. We're focusing on more on your whole grains and your quinoa and your
high
fiber foods, lentils and legumes and other forms of unprocessed foods, and eliminating the cool drinks and
high sugary foods. And I think another one is I get a lot of patients who ask me, is like fruit good for you? Because fruit has sugars in it. It has fructose. So people, I think, are like, oh, anything that has sugar is bad for me. And that's not true. Fruit is a low GI source. So it's going to slowly increase. Exactly. It's has so much fiber in it.
Fruit has
so
fiber.
We want you to eat
Yes,
fruit.
Obviously in moderation.
Yes.
You're not going to go and eat like 10 fruits after each other, but it has other minerals that are so important.
Exactly.
Rather eliminate the fruit juice and have an apple or have a pear.
A pear.
And enjoy the fiber that comes with it, because your
Exactly.
body responds better if something has fiber. It just slows down that spike, and it slows down digestion, and you keep your GIT and all of the microbiome happy.
Microbiome, exactly.
So that's also very
I think
important.
I speak about fiber so much. I'm so like fiber.
Fiber fuel. That's a great book, by the way. So you were speaking about people being obese.
Yes.
And how that in our culture it's difficult, because let's face it, body positivity is a good thing, but it can become a negative thing. And I see it a lot with people of color, and how curves are, cherished and celebrated, which it should be, but to an extent where it's negatively impacting your health. And touching on that subject is very sensitive, because you don't want to, and I don't want to body shame. I never want to come across as someone. You want to be positive about it. But with that comes the realization of your risk. And you can be positive, but what can you do to, mitigate the risk of becoming diabetic? Because, yes, you can be body positive now, but if you get diagnosed with diabetes, how do you live with that?
That's true. That's very true, hey?
If no one warned you.
Diabetes, hypertension, cholesterol. So what you're basically asking me?
We were speaking about BMI previously, a random conversation that we had, and you mentioned waist circumference.
Yes.
And these are all measures that we use, right?
Yes. I told you, I think before, I have a love-hate relationship with BMI, because BMI will measure your weight for your height, right? But your weight consists of everything in your body. It consists of your bones, the water content, your muscles, everything. So if I'm working out and I have a large amount of muscle,
you're going to weigh more.
I'm going to weigh more.
I always say muscle weighs more than fat.
Literally.
So it's not a true representation.
It's not a true representation. Health. So you always have to look at those things of like, I stand on a scale and it says I'm 80 kgs, but I've been working out every single day.
Yeah.
Does that really mean, according to BMI, that I'm obese?
Yeah.
Like, we need to take these things into
consideration.
Account.
And look at it as a whole. It's a good guiding point.
Yes.
And if you can, that was my dog.
I
said. For those who are wondering, it's my dog snoring on the sidelines.
He's like, you guys are talking. I don't know what you're saying.
So BMI is a good guide, but it's not the aim, and not to be obsessed about it, and to also consider these things like you're talking about muscle mass. And some people are extremely tall, but they're slender, and then they say, okay, they're underweight.
I'm underweight.
Yeah, or they're malnourished or whatever. So, using your judgment as a clinician, as a dietitian, it's obviously important.
Yes.
So then we were speaking about waist circumference. So what are those numbers again?
Okay, so we use WHO as the World Health Organization as a guideline.
WHO? WHO. Oh, okay. WHO Day.
Okay.
No, everyone says different things. So it's just interesting. Yeah.
So WHO recommends that men need to be below 102 centimeters of their waist circumference.
Okay.
If it's over 102 centimeters, it means you have a bigger waist, so that means a bigger belly, which puts you at risk of diabetes and other cholesterol, at risk of your
disease,
chronic diseases of lifestyle.
Yeah.
For women, it needs to be below 88 centimeters. So if it's above, then it's also at risk. Because I think we spoke about it in our PCOS episode as well.
Yeah, we did.
About the hormones according to your weight. When you increase weight, your hormones go
haywire.
exactly. So when your waist circumference is a bit larger, the hormones, and that's mainly insulin that goes
insulin
crazy.
So that's how you also, I mean, it's also all of that increased adipose tissue around your organs.
Because that's basically what your waist is. When it gets bigger.
That's always the first place. I mean, we were discussing as well how I was borderline that last year. And how I had got the fright of my life when I was like, oh my gosh, I'm touching 88. And that was a wake-up call for me, that I need to start looking after my own health. And also be an example, because how can I preach these things if I'm not, looking after my own health? And I mean, it happens so quickly. Like, you don't even realize it. And then
you look in the mirror one day and you were like, how did I get here?
So, I mean, I don't have PCOS. And that just was an eye-opener for me. And I mean, fortunately, I took my health a bit more seriously, and those centimeters came down when I went for my Discovery Health check. They did a waist circumference, and they were like, "Okay, it's adjusted. We're not concerned," So I was very happy for that. And
that
grateful.
Must have felt so nice.
Yeah, because I mean, again, my BMI was like borderline, but because my waist circumference was like 10 centimeters less than what it was, I was like, okay, that's great. So I'm probably at risk, like any South African, of diabetes. And taking that seriously was, good for me, but also for the people I work with.
Exactly.
So how do we measure waist circumference?
Okay, so this is
it's a bit tricky.
It's tricky. So what I do, it's difficult to see waist. Some people it's easy. Some people it's
depends
difficult.
on the tummy. Where is the tummy? Like, where do you measure? But just a rough guide.
Okay, so it basically is the top part of your hip bone. You need to identify that. And then the bottom part of your rib. So basically your last rib and the midpoint of that. So half of that's your waist. But then it's difficult depending on how big your waist is to find those bones. So what I usually do is I tell someone to like lean to their side, and then that fold that you find when you lean, just
the cute little fold,
just take that
as the midpoint.
Yes, as the midpoint, and that's basically your waist. So just put the tape there and then make sure that it's straight. And then you can get
and not
your
pulling
waist
in your tummy.
You need to
relaxed.
make sure you're relaxed. Because pulling in your tummy is not going to do anything. You're not going to get proper...
You're just going to have false reassurance.
Exactly. And we're trying to prevent a lot of bad things happening. So we need to be honest with ourselves.
So I think this is a good point for anyone who's listening, just so that they could be aware. Because another thing that I did was, at my place of work, encourage everyone to just be aware of where they are in terms of what the guidelines are saying. Where's your waist circumference, so that you could be aware of your risk. Are you at risk of diabetes and other diseases of lifestyle? And that's empowering. You don't need a doctor to measure your waist circumference. Anyone can do it. Most people have a waist tape measure.
I feel like most people have already done it when they're trying to buy clothes online.
That's also true. If you do it for these online clothes, you can do it for your health, and it's something we should encourage a bit more. So that's a good marker. And then also to have that goal, then it's not just the number on the scale, but it's actually the centimeters which count.
Exactly. And you'll be, once you measure your waist and you start exercising and the scale doesn't move, your waist is going to move. And that's so motivating
to continue.
Exactly.
That's another thing that we always speak about is, how to accurately assess your progress.
Exactly.
And not to be disheartened if a number of the scale doesn't move by centimeters.
And while we're talking about risk factors, do you know any other risk factors for diabetes? I know genetics is one. So if you have diabetes in the family, then you're at a higher risk.
You're reminding me of the saying where it's like diabetes runs in the family, but also no one in the family runs. So I think it's like, because that speaks. That is so funny. Because it speaks to behaviors, right? Like, it does though, because I mean, It's so powerful because a lot of things are genetic, and then people will relate it to, oh, it's like it's meant to be. But I mean, like, I have diabetes in the family, but there's certain things I can do to prevent. I don't like running, but I can exercise to try.
So there's no one in your family that runs?
Not really. We're not actually a family that runs, but walking, we'll stick to walking, and other forms of exercise. So we always speak about exercise.
Yeah.
Another thing, like we've spoken about muscle, strength training, and how you always say muscle's like a sponge for the glucose.
Yeah.
So the more muscle you have, the better your sugar control will
Exactly.
be. So
you need that sugar to help that muscle.
And your muscle
go.
needs the sugar, and your muscles will grow, and overall long-term health and strength and everything will be better.
Exactly. So how many minutes a day should we exercise?
Yeah. So they're actually, the guidelines usually is a bit higher than 150 minutes per week. But again, let's be realistic. Anything is better than nothing.
I agree.
And starting slow is better than not starting. And realizing that you need to exercise is important. And people who, I find, like, as humans, we always find that one case where someone overdid it. Like someone did too much exercise and something bad happened. And then it's like, I don't need to do exercise.
It was one of those auntie stories.
Yeah, kind of. But we also need to realize that, everything in moderation. Like, you can't over-exercise and expect to be the healthiest person. Okay, some people are, but I mean, they obviously need to listen to their bodies. I always say, listen to your body, What is your body telling you? But to aim for that 150 minutes per week is a great start, like we've spoken about before. And so much so for diabetics, for their glucose control. Yes.
Yeah, I just say, as long as you're moving your body.
Yeah.
Like, start slow, as you said.
Yes.
Start
Go for
with
10
your 10
minutes.
minutes. Exactly.
10-minute walk, 5 minutes.
Just make sure your heart is like pumping.
A few squats,
Exactly.
something to get your, like they speak about, and it's becoming more popular, like exercise snacks. Like, if you have 1 minute, go and like run up and down the stairs.
Yeah.
You know what I mean? Like, move.
Stairs is so good.
If you don't have an hour at the end of the day, maybe try and find 5 minutes while you're in a meeting, walk on the spot, or get creative.
Yeah.
Because your health is your responsibility. And there shouldn't be a focus on just taking a pill for every ill. Like, a pill for every ill. It's like, no, you need to work on your own health so that also we can prevent this. I mean, South Africa, we are so sick as a nation. I just like talking about it. Just
I can see.
It's
so passionate. You're so passionate.
No, it's because I've worked at the ends. I've worked at.
You've seen a lot of things.
Yeah, I've worked in busy emergency rooms where the burden of disease is increasing. And when you are in the situation and you can see that this person is at the end of the disease, like this disease has consumed them. And it's sad because we could have tried to prevent this. And that comes through education, prevention, and people understanding why it's so important to do these things for themselves.
Oh, that got deep, eh?
Sorry.
But it's so true, though. Like, we need to do a lifestyle change. Like, we need to check our diet. We need to exercise.
But I mean, also society needs to understand that, women are dying from diabetes and its complications, especially women of color. And if we realize that we are making each other sick by, not speaking about it, speaking about the truth, about having a healthy weight. I'm not saying, restrict yourself to the point of not enjoying life, but realizing you need to move, you need to be aware of what you're eating. And at the end of the day, that comes from behavior change, which is such a difficult thing. People don't have time.
It's a difficult thing.
Yeah, doctors
it's difficult
struggle.
for me as well.
Yeah.
But we get there. Like,
Yeah.
do one step at a time. It doesn't have to be difficult.
I know, but I'm talking more about from like a doctor's perspective.
Oh, okay. Yeah,
like, you don't necessarily have time.
Yeah.
Because, and also to change someone's mindset, it has to come from within.
Yeah.
From that person. So a behavior change is quite a struggle, especially in our setting. But looking at those stats that I mentioned, it's so important.
It is, yeah.
We need to realize how sick we are as a country and that we have the highest burden of diabetes in Africa. And that's, that's scary. And it's only increasing. So where to from now? Yeah.
And I know, so we've mentioned a little bit about diet, exercise now.
Yeah.
And I know you're passionate about sleep.
Yes, because everyone knows sleep is important.
Yeah.
Right? Yes, I'm very passionate about sleep. But because, and it's so easy to fall out of a good sleep routine.
Yeah.
Yes.
So how does that work in diabetes?
So sleep is important for everyone. 7 to 9 hours is the recommended amount of sleep you should be getting every night. And it's difficult because sleep and lifestyle choices and the food that you eat and your exercise is all related. And once you start doing one good behavior, especially sleep, if you're well rested, you're going to feel more inclined to eat better.
That's true.
To exercise. You're going to have energy to exercise.
That's true. Yeah.
You're going to have energy to socialize. You're going to have energy to spend on your mental well-being. If you're sleep deprived, and I think, again, it's because I was so sleep deprived for so many years. Like, I feel like a new person.
Yeah.
Having sleep every night. People think it's crazy, but I mean, how many hours did I stay up late at night, working?
Yeah.
So sleep is so essential. So working on your sleep routine, going to bed, trying to get to bed a bit earlier so that you can get at least 7 hours, setting an alarm on your phone, a sleep mode where it warns you, okay, rest now.
To sleep.
Trying to turn off the TV and not consuming caffeine past 12 o'clock in the afternoon is essential steps. There's many things we can go into about sleep, sleep hygiene, but looking and focusing and doing your reflection on yourself. What am I doing that's, affecting my sleep? So that's a very important thing for us. Okay. Yeah.
And I think also with the sleep, something I also say is put your phone down when you get into bed.
Yes.
Like, put it off.
Put it in another room.
Put it in another room.
Get an old school alarm clock. I heard about that the other day.
Scrolling on Instagram, TikTok, all of those things so late at night, it's what causes our sleep to
It's that blue.
decrease.
It's that blue light.
Yeah.
And also the TVs. It interferes with your brain.
Yeah.
And knowing if it's daytime or nighttime. So trying to limit screen exposure at least an hour to 2 hours before you're trying to go to bed is actually what we all should be doing. And for diabetics, I mean, we can look at the person as a whole. Like, yes, they have diabetes, but also sleep is what's going to help them, control everything. So
true.
And
This was so interesting.
So interesting. We have so much more to speak about. We didn't even touch on, the medical management and monitoring of your glucose and insulin and all of that. And yes, I think it calls for some, resources to help people. And I think we're going to attach some of our free downloadable
we will
resources.
attach our resources
We
to
know
this
it's needed
to help you guys.
Yeah.
Easy and make it easy to understand for you guys.
Yeah, because we need to take it seriously, but also educate each other, encourage each other. So do what you can to encourage each other to move more, to eat better.
Yes.
And it was so fun pairing with you today, Alicia.
It was fun pairing with you too, Andy.
Pairing our information and don't always have access to, the dietitian to give that advice.
Yeah.
And I'm sure, as always, when we end the podcast, you'll be like, I didn't think about that. But in our resources, I'm sure we'll expand on some of those helpful tips that you have. So
So guys, don't forget to like, comment, and subscribe for more.
See you next time.
See you next time.
Bye.
Bye.